I get this question all the time. A lot of people don't really like to answer it straightforward. What is dry needling? Dry needling is a type of acupuncture. Physical therapists are the ones that started labeling it as such because they don't want to outright say that they're using acupuncture needles, which they are. When you buy the needles, it's not a dry needling needle, it's acupuncture. It is a physical form of acupuncture that I've been doing for about 20 years. It's what I was trained in primarily. It's phenomenal for tight muscles, for sports injuries, for migraines, for a lot of range of motion issues, you name it. It's phenomenal. Low back pain. But the main area that it's viewed in terms of the wider society is sports medicine, injuries, because it's done by physical therapists, sometimes done actually at sporting events, because it can take a muscle out of being in spasm immediately. I do it in my clinic. As an acupuncturist in New York, I am licensed to do it because physical therapists different states have different licensing. They are not licensed in physical therapy to do acupuncture. So now I've taken my acupuncture training and I've expanded and supplemented it. I became a certified personal trainer, rehabilitative exercise specialist. I've taken plenty of courses on biomechanics. So I have a nice understanding of the human body. I'm not a physical therapist and I'm not pretending to be. The training that an acupuncturist has to receive to be licensed is over 2,000 hours. I've also got 20 years of experience and probably over 2 million needles. Physical therapists are under the, I believe they self-regulate, and it's either 3 or 6 days worth of training in order to start doing what they call dry needling. Some physical therapists are very good at it. Others, because the standards are not particularly rigorous, are not. That's all I'm going to say on that topic. So the dry needling is really good. In terms of after effects, there will be soreness often. It'll feel like a workout. I tend to work pretty extensively to release the antagonist and other related muscles. This helps the treatments to hold longer. Sometimes instant resolution, you don't need to come back. A lot of times I'll recommend CBD cream. The one that I carry, CBD Clinic, is remarkably effective. And sometimes I'll recommend various stretches, and I'm doing more and more of that, not actual stretches, but movements and exercises to rebalance and prevent the condition from coming back. All of this to say, dry needling, also known as trigger point acupuncture, is highly effective for musculoskeletal as well as other chronic issues. Most people will see a result in the first visit. Some people need to come back in order to really lock it in. That's called the durability of treatment. But you name it, sprained ankles, foot pain, leg pain, back pain, neck pain, headaches, eye pain, digestive issues, rib pain, breast pain, arm pain, tennis elbow, shoulder issues, knee pain. I saw a woman yesterday, she had knee surgery. She's been in physical therapy for 5 weeks. She came in for a completely unrelated condition. She did not even put knee pain down on her intake form. She mentioned it as an aside. I did 2 or 3 needles in her leg to loosen muscles. I also asked her, are you having difficulty when you go downstairs? That's a question that's specifically targeted, because if the leg feels like it wants to go out, that's a question specifically targeted to the hamstring on the inside of the leg. She said yes. So I did vastus medialis and the medial hamstring. I had her move. The leg pain post-surgery for 5 weeks of physical therapy that had persisted resolved right there on the spot. That's why I do it. That's why patients keep coming back. And that's why I'm trying to educate you, because in New York State, dry needling is only allowed to be done by licensed acupuncturists or people who are certified in acupuncture. Furthermore, it is one of the more skill-oriented methods of acupuncture. Because it is more aggressive, the skill of the practitioner is paramount to minimizing the pain and maximizing the durability of the treatment. Dr. Chris, Scarsdale Health and Wellness, I hope to see you soon. If you have any questions, please contact my office.